Good afternoon, everyone, and welcome to Getting Personal with Parkinsons, a Facebook Live series that we do in conjunction with Northwell Health. I'm Caroline Colas, the Senior Director of Health and Wellness for the Marlene Meyerson JCC Manhattan and the Program Coordinator for the Edmund J. Safra Parkinson's Wellness Program. For over 12 years, the JCC has been hosting programs for individuals living with PD. You can find these programs on our website, www.mmjccm.org/Parkinsons. And we will put the link below in the comment section. Please take a moment if you're listening and share this Facebook Live so that others can join us. For those who join us for the first time, welcome. This program is for anyone whose life has been impacted by Parkinson's and those curious about Parkinson's. We want this conversation to help put a face to those that live with Parkinson's and those that treat them, and to introduce you to people living and thriving with PD, as well as experts who will share updates in research and practices that can support those living with PD. We welcome your input if you want to be a guest, or if you know someone we should feature, or if there's a specific topic that's of interest to you, please let us know. All inquiries can be directed to Whitney Chapman at wchapman@mmjccm.org, and her information will be in the comment section below. And now, I'm excited to introduce you to a friend and an amazing colleague, Dr. Rebecca Gilbert. Dr. Gilbert is the Vice President, Chief Scientific Officer at American Parkinson's Foundation. Dr. Gilbert received her MD degree at Weill Cornell College of Cornell University and PhD in cell biology and genetics at the Weill Graduate School of Medicine Sciences. She then completed her neurology residency training as well as movement disorder fellowship training at Columbia Presbyterian Medical Center. She continues to maintain a limited schedule of patients 1 day a week through Bellevue Hospital Center. Dr. Gilbert has presented for us at the JC several times. She's worked with our faculty and staff over the years, and I'm thrilled to have her on the show today. We pre-recorded a chat that Dr. Gilbert and I had, and we're going to share that with you now. And afterwards, she'll come on live for any Q&As. So if you have questions as you listen to our conversation, please put them in the comment section and we'll happily answer them. And now, on with the show. Welcome, Dr. Gilbert, to the call, Getting Personal with Parkinson's. It's such a joy to have you here. May I call you Rebecca?
Of course. It's such a great pleasure to be here. Thanks so much for inviting me to join you for this conversation.
So I would like to know a little bit more about you. And this series is called Getting Personal with Parkinson's. And I just wondered from the very beginning, what got you interested in neurology? I have a niece that's considering medical school, and she's interested in the brain. And I wondered not only for just in general, when you're interested in the brain and neurology started, but I also wonder what you would say to young people who might have that interest as well.
Sure. So when I was thinking about, what to do with my life, and I decided I wanted to be a doctor. So I had any number of parts of the body that I could have studied. And what drew me to the brain was that unknown, that final frontier feel to the brain. We think we know a little bit, but everyone would agree that there is much, much more we don't know than we do know. And that really intrigued me. And it made me want to learn more. And I think that really is what differentiates neurology from most other fields of medicine. And so that's where it started. Yeah.
And would you still say that it's kind of the wild, wild west, that it's a big frontier?
Absolutely. I really, really do believe that. Every day we get a little closer to understanding a little more, that's for sure. And even in the time between when I was in medical school and now, which is, a couple of decades, there has been just incredible amounts of knowledge that have informed how we treat people, et cetera. And, just recently I learned about a new epilepsy medication that was just approved. I'm like, oh, got to learn about that one. I'm a neurologist. I need to know all the new approved medicines, even though it's not something I work with every day, but there's always new things happening. So you do have to kind of keep on your toes. And that's really exciting as well.
So you went from medical school, and then how did you pick specifically Parkinson's?
That's a good question. I did not have anyone specifically in my family with Parkinson's. I did not have any personal experience with it. So that isn't the reason for me, although that is the reason for many people. I was interested in finding a sort of subspecialty within neurology where there was sort of this feel of not having complete understanding and knowing that we had a lot more to learn. But at the same time, there were treatments available and there were things that could be done. So I wanted that sort of middle ground. And that's sort of where Parkinson's is right now. And I think people who have the condition, who are faced with the challenges of Parkinson's, would agree that that's exactly where we are. There are definitely steps we can take. We can talk about those steps, but there's a lot that we don't know and a lot of research that still needs to be done. And that's the balance we're in.
Recently, you spoke at our Parkinson's Now event, and you were really introducing the idea that our lifestyle can have an impact, a big impact on both prevention of Parkinson's and also when we're diagnosed, and also delaying progression. Can you talk a little bit about that? Is that something that's one of those areas that's relatively new in some regards?
So it is relatively new, but I think it's gaining a traction. And I would say when I was doing my fellowship, which is about 10 years ago at this point, there was already some talk about these topics, but they've definitely gotten louder and more front and center over the past decade. And the idea being that it's sort of intuitively obvious that if you are in a healthy body and you have a good exercise tolerance, that you will move better. And so if you are not physically fit, you may be overweight, you may not be able to walk well for a whole bunch of reasons. Maybe you've been overweight your whole life and your hips, giving you a little trouble. Maybe you have a little bit of swelling in your legs from too much salt in your diet, or whatever the reason may be, then you're not going to move as well. And everyone knows that. And we all know that people move better or worse depending on their lifestyle. Now, add on to that, let's say you don't move so well because of your lifestyle, add on to that a brain disease. Well, you're just not going to do as well as somebody whose body is fitter and more able to accept the challenge of a brain disease. And so I don't think it's anything radical at all to say that being physically fit is going to be a positive thing for somebody who has the challenge of Parkinson's disease. But I think studying it more formally is what came in the last decade. And with more formal study, it's become very clear that exercise can do all sorts of good things for you, including delaying the onset. If your genetics, for example, have determined that you have an increased risk of Parkinson's disease, a healthy lifestyle can delay the onset epidemiologically, meaning looking at all the people with that same tendency or risks of developing Parkinson's. Those who have the healthier lifestyle will, on average, develop the disease later. And in addition, once you have the disease, will make the motor symptoms easier to tolerate and some of the non-motor symptoms of Parkinson's easier as well, including things that can be difficult for people with Parkinson's, such as constipation, fatigue, depression. So there's many advantages to living a lifestyle where you're physically fit. And so practically what does that mean? It means following the CDC guidelines of raising your heart rate to moderate to vigorous exercise, about 150 minutes a week. That's standard recommendations of the CDC for older adults. And thrown into that, some strength training can be very helpful as well. Balance training can be particularly helpful for people with Parkinson's disease, and mixing it up and keeping it interesting is always important for the brain. So that's definitely something that all doctors or movement disorder physicians who see people with Parkinson's want stress to their patients these days.
Yeah. And what about genetics? Can you talk a little bit about that? I remember when we first started the program, 13, 14 years ago, we didn't think that there was that strong of a genetic component, but that has changed. And now there is a genetic component. Can you kind of update the audience for some of whom who might find that surprising to learn?
Yeah, so I wouldn't say that genetics is all determining. That there is a reason why it took many decades for people to realize that there was a genetic component, is because it isn't that obvious. Meaning, if a disease like Huntington's disease, for example, which you may or may not have heard of, that's very, very clear. You have a parent with Huntington's, you have a 50% chance of getting it yourself. End of conversation. That is definitely not the case in Parkinson's disease. And so the genetic links are less robust, and it's extremely complicated how the genetics of Parkinson's plays out into the actual developing of Parkinson's. And so it's not something that you can sort of explain in a few minutes. It really does require a lot of background knowledge and sort of thought out presentation. So I don't want to not do it justice, but the bottom line is that the genetics of Parkinson's disease is the genetics of a complex disorder. So there are many different risk factors that feed into whether you will or will not develop Parkinson's disease. There are some families that do have a very, very strong genetic tendency to Parkinson's disease, and they carry rare mutations that raise your risk a lot. Those are very rare situations. Most people have a bunch of smaller increased risk genes that sort of come together and increase your risk by a smaller amount. And so it is a very complex situation. So what I would recommend is, if you do have a first degree relative with Parkinson's, you have a parent with Parkinson's, and your parent may or may not know their genetic profile, then you may want to discuss with a neurologist whether it makes sense for you to get genetic testing to see whether you do carry one of the mutations that are already known about, and to see whether your risk of Parkinson's is increased. Recently, there have been clinical trials that have focused on people with specific gene mutations. And when that becomes something that's possible to join a clinical trial based on a gene mutation, then knowing your genetic status becomes more important. So this is an ongoing conversation, and genetics are becoming more and more important in the conversation about Parkinson's disease.
This is so helpful. So you also said at our event at the JCC that we are sort of about 5 years away from, what was it, some of preventing Parkinson's,
Right.
maybe some therapies that might prevent it, or talk about that a little bit.
Right. So, there's the holy grail of a neurodegenerative disease, or a disease where the nerves in the brain die without us really knowing why. And that's Parkinson's is one of those diseases, is slowing down the disease, stopping the nerves from dying, and preventing additional nerves from dying. That's what we have to figure out how to do. And the medications that we have available right now for Parkinson's disease are all symptomatic treatments. So as everybody knows, Parkinson's disease causes a whole slew of symptoms. Some affect your movement, some affect your other parts of your functioning. The movement symptoms may cause tremor, may cause slowness, stiffness, problems with balance, etc. All those things. And the medications that we have can improve the slowness, the stiffness, the tremor, potentially the walking, potentially. And that's very good. We need those treatments. But what we're really, really looking for is a treatment that's going to stop the nerves from dying, so that we don't ever get to the point where we're slow and stiff to begin with. And so clinical trials, there are a whole bunch of clinical trials now that are looking at ways to do that, really getting to the heart of what happens in the cells and trying to prevent the pathology from happening. And that's really exciting. Now, that isn't to say there haven't been many, many clinical trials that have been trying to do this for many years. There have been a tremendous number of failures in clinical trials over the last 10 to 15 years or more. Of these, what we call disease modifying therapies, or therapies that are going to actually protect the nerves. And we've had a lot of failures. And so we're sort of trying to be smarter about it, trying to potentially get to patients earlier or get to patients, let's say, with specific gene mutations and focusing on subpopulations that may benefit more from a specific type of treatment. And so right now there happen to be a number of different molecules that are looking at this disease modifying aspect of things. And so that's really exciting. And I'm certainly hopeful that one of these will prove effective and will become a treatment that slows down the disease in the long run, which is
that would be amazing.
like to do. Yeah.
That would really be amazing. And then I remember we had, well, we've done many things together from Max Gomez. Remember that? We did it. We were on
Yes,
that
I
one
do
show.
remember that.
That was hilarious. And then I remember we had a panel, you were on a panel, and we were talking about nutrition at that time. And that was years ago, and there really wasn't that much research to support a particular diet, but that's changing as well, isn't it?
Yes, it is. And when you asked me about lifestyle and I talked a lot about exercise, of course, diet is going to be the counterpart of exercise, because you really do need the two of those together for a healthy body, of course. And, whatever you put inside your body is what you have to work with. So diet is really extremely important. There was a very recent study which looked at two diets, the Mediterranean diet, which you may be familiar with. And that's a diet that's typically eaten around Mediterranean cultures, so in Greece and Italy, etc. And in those diets, they tend to have an emphasis on vegetables and fruits, things that grow. They tend to use fat that is based on olive oil, as opposed to animal fat. And they have a preponderance of things like nuts and legumes in the diet to provide protein, and then low-fat animal proteins such as fish or chicken, as opposed to beef. And that's sort of the heart of a Mediterranean diet. That diet was modified a little bit to become, or to evolve into, something called the MIND diet. And as it suggests, it was studied for brain protection. And the modifications of the Mediterranean versus the MIND are very similar. The MIND emphasizes green leafy vegetables over other vegetables, so kale and spinach and things like that. And the MIND diet also emphasizes berries over all fruits, and it also emphasizes red wine in addition to all the other components. And with these types of diets, a study was done recently about delay of onset of Parkinson's. So looked at lots of different people who had Parkinson's disease and asked them about their diets, and then saw sort of how old they were when they got Parkinson's disease. And the people who were more adherent to these diets had Parkinson's later, which implied that these diets can be very effective to help protect brain cells from the damage that may be coming for whatever reason, for genes or whatever environmental causes, which we haven't talked about yet. And so that additional protection seemed to come from the diet. So that was very exciting. And it really just supported things that we're learning and that we know intuitively, that these are important ways to stay healthy.
Are the cases worldwide of Parkinson's increasing, and specifically in America as well?
That's a great question. I mean, there are definitely those who argue that is the case. Certainly, I should say that their cases are increasing. The question is why. Most of the increase can be attributed to an increase in the age in the population. We just live longer and we have more older people, and age is definitely a huge risk factor for Parkinson's. The argument is is that all that's going on? Is it really just an increase in age, or is it other things that may be increasing Parkinson's risk, including some environmental factors, that some of which we know about, some which we may not know about yet, etc. And that, I think, is an unanswered question. So for now, we do know that cases are increasing, and the specific details of why is up for our understanding and research.
A couple of questions regarding that, like for the everyday consumer of, sort of pesticides, household products, lawn things. Are there things, I've heard that solvents and pesticides can also be a contributing factor. Are there things that we should be staying away from, that we should be sort of writing our congressmen and women to sort of protest and get banned? Are there substances that we actually are sort of legal that are potentially harmful for us in relationship to Parkinson's?
Yeah, so I just had this wonderful conversation with Dr. Carolyn Tanner, who's an expert on this, and I cannot claim to be an expert on this, so I don't want to misstate anything. But the general idea is that there is evidence that certain pesticides increase the risk of Parkinson's. One is paraquat. This is a pesticide that is illegal in the United States. Is legal in the United States, but is not legal in many other countries in the world. It has been banned in other countries. And there is a movement to ban it in the United States as well. Whether this is going to happen is unclear, but there's certainly a movement within the Parkinson's community to push to ban this particular pesticide. But what was very interesting about Dr. Tanner's talk is that when farmers protected themselves from paraquat exposure with the right protective equipment, their risk went down. So it isn't that, this is what the bad people are doing to us. We need to, take as many precautions as we can. So there are ways for farmers to protect themselves from the increased risk. To introduce these concepts to our legislature, make sure they understand, what kind of risk we're talking about, and to try to ban specific substances as well. And there probably are many other substances and interactions with our environment that we don't yet know or haven't been studied enough that may increase risk as well. But as we gather information, we can try to make some conclusions about our environment. But what we really can do is focus on what we can control. And that's what we're talking about here with exercise and diet, and certainly getting involved and trying to ban substances that we know increase the risk is certainly important. And that's something we can sink our teeth into, and then adapting or adopting our own healthy lifestyles can help ourselves in ways that only you can do in terms of your own risk.
Would you say to somebody who sort of has mid-stage Parkinson's, who's noticing that they have all this information, they've done what they can with diet, they've done what they can with exercise, but they're noticing some progression, and there's an anxiety around that. There's a challenge of what else can I do, especially if balance is a little bit off. Any thoughts about that situation?
That's a great question, because you hear this from people, stop telling me to exercise and eat healthy. I do all that, and this is, and it's an unfair disease, because you hate to be blaming the victim and saying, well, if only you had eaten better, if only you had exercised more, you wouldn't be in this position. That isn't the case. This disease does what it wants to you, and the challenges are there no matter, even if you're trying your best. So, my talk about diet and exercise are not meant to point the finger at anyone. And so that's a really excellent point, and I'm glad that we have a chance to emphasize that. And so if you are finding yourself having done all you can and progressing anyway, that happens, and it isn't your fault. And at that point, what you really want to make sure that you're doing is speaking with your neurologist about making sure you're having regular physical therapy. Because what happens with Parkinson's disease is you are trying to stay in one place when the river is trying to push you back. It's like a salmon swimming against the current. The salmon really wants to stay in one place, but that stream is constantly trying to push the salmon back. So what you're trying to do is stay in one place. And in order to stay in one place and not be pushed back, you want to just keep maintaining yourself. And what you need to do is keep training your brain to stand big, stand tall, make big movements, speak louder. You're fighting against these tendencies that your neurons want you to do, which are to be smaller, to stoop, to become more enclosed, to be silenter, and you're always trying to fight against those tendencies. And sometimes and often you need professional help, which comes in the form of fitness therapists like yourself, Caroline, or physical therapists and occupational therapists.
Our program has been going on for 12, 14 years now, and so we have people that have been with us since the beginning, and some of them are experiencing that. They're like, I come to class and I eat well, and I'm doing all that I can, and I still notice that this is happening to me. And it's also important just psychologically to, I think we had Christopher Jones, who's in our program, and he was talking about how important it is to find something that you can still do, right? That makes you feel like yourself. So he was a professional and is a professional actor, and he found that he could do some translations in Russian, for example. And so he was still connected to his his profession, but in a unique way or in a different way. Do you find that a lot with your patients? That and let's talk about that as well, because you are now the transition from seeing patients to your current position. So how did that come about, and do you still see patients, and why? Is there something rewarding about that for you?
Yeah, so you've mentioned so many excellent things, and I to start from where you started, I definitely agree that staying connected and maybe modifying what you used to do can be beneficial. I had a patient who was a professional photographer, and he would take his pictures and he would go to his dark room and he would develop them, and then he couldn't manipulate the chemicals anymore, and his wife really wanted him to go to digital camera, but he just absolutely refused, and that was so instructive to me, that if only we could have tried to explain and get to him that it isn't a failure if you're modifying yourself so that you can still create, and I try to give that message to people that, it isn't a capitulation, it's a continuation. And I had a great conversation with David Leventhal about dance, and I had a conversation very similar to the one we're having on Zoom, a virtual conversation, and a question came from the audience about how frustrated she was because she couldn't dance the way she used to. And his answer was amazing. It was, everyone's body changes with time. Yes, Parkinson's may escalate that and may make it more rapid, but every dancer as they age is going to have to adapt. So don't think of it as a capitulation. Think of it as an adaptation. Think of it as, now this is what my body is like. And you can use a rhythm, just make the rhythm half as fast, just accommodate, don't capitulate. And I think that was such a good message. And I think that that's something that everybody as they age needs to understand, and certainly people with Parkinson's. Now, to talk about me and my transition. So I was a movement disorder physician for 9 years, saw patients, at NYU for many, many years. And then the opportunity came up to become the chief scientific officer at American Parkinson's Disease Association, hence my logo behind me. And I transitioned to that about 2 years ago. And I kept seeing patients 1 day a week, where I continue to see patients on a limited basis, which keeps me grounded. If I didn't have that, then I would feel like I don't really know what's going on. I wouldn't be up on the new medications. I wouldn't be up on any of the new strategies. So that really is very important to me, to keep seeing patients. The rest of my time as the chief scientific officer, I'm able to see the world of Parkinson's a little more broadly. So I don't necessarily have, the 15 patients I'm seeing in the 1 day. I can try to influence more people at the same time. And that's very exciting. So as the chief scientific officer, what I'm charged to do is twofold. I'm in charge of our research portfolio. So as an organization, we give grants both to academic institutions and to individuals who are working on Parkinson's disease research. The other part of my job is managing the medical information that comes out of organization. And for the most part, that's what people come to us for. We have educational materials, we have webinars, we have a website, which is tons of information. And so staying on top and making sure that we have all the newest information that's out there and that's up to date, so that people can feel empowered. And so that's the other part of my job. And people reach out for information all the time from all different angles. Just yesterday, I had a conversation with a small startup that is looking to get to sort of transition their idea into Parkinson's disease from another area. And they didn't really know much about Parkinson's. I'm asking all sorts of great questions, and they didn't really know how to get information about Parkinson's. Well, American Parkinson's Disease Association sounds like a good place to start. So they reached out, and so I was the person that was able to educate them. So it gives me a lot of great opportunities that I never would have had before to really try to influence what's going on and who knows what about Parkinson's. So it's a very exciting job, and it's a really fun job to do too.
And it kind of goes back full circle, doesn't it, to your original interest in neurology?
It does. I mean, it's a way to stay on top of the research, to influence the research, to be part of the conversation about the research, and to know what's coming in the pipeline, and to be responsible for knowing what's coming. Because often I'll get a question, I field all sorts of questions from people out there, and they'll say, have you heard about this study that was done in Denmark 5 years ago? And I'm like, actually, no. And then I'll have to go search and find it. And like, oh, well, I just learned something today. So I'm constantly learning and staying on top of things. So it's great to be able to say that your job makes you learn every day. So I feel very lucky.
And what has surprised you about Parkinson's or being in this field?
I think what surprised me is how tenacious people with Parkinson's can be. I think that there is a general sense, and I would say I've known this for many years, but let's say as a medical student or earlier on, I think there's a general feeling in the world that if you have a disease like Parkinson's, well, you're now an acceptor of goodwill. You are now a receiver of help. And that's how that's how the world goes, sometimes. And that really isn't the case. Parkinson's disease is such a wide spectrum. And there are people with Parkinson's living with the disease well, doing all sorts of things, contributing, modifying themselves maybe, but staying active, and seeing that is really, really heartening. And then, of course, you see people who are progressing, against all their efforts, and then seeing the grace that people have to accept what they can't change, and to work within their limitations to continue to contribute what they can. And I think that's been a wonderful education for me to witness that.
And then, of course, many of your patients, taking care of people with Parkinson's, it's kind of a long-term care situation. And I know that that has been the case for us too. And when we lose somebody in the program, it's tough. Do you find that as well, that these,
Oh,
you've
yeah.
had patients for years and years and years, and to see them, it's how do you mitigate that loss?
I don't think you
yourself?
can. I think that it's one of the challenges that movement disorder physicians have, is that they have to be open to loss. But as with any doctor who interacts with patients as they age, this is part of life. And I think that's something that we're learning to deal with a little bit better than in the past, that death is part of life. You can't escape it. No one can. And it's something that you want to respect, and be aware that it's could come, and to talk about with people as it seems to be approaching, so that it is something that the family can be aware of and accept. And even to talk with people themselves with Parkinson's disease about it as well. So I think it's something that is a challenge. It's not part of our culture to be comfortable with these conversations, but it's important for people in my field to feel as comfortable as we can with this topic.
Beautiful. And finally, what are the kinds of things that you do to remain healthy and well, and what has PD taught you?
So, I said this on our conversation the other day, and it really is true, which is that there was a time when I would say to my patients, what is your exercise regimen like? And they'd say, I don't do enough exercise. And I'd say, you need to do more exercise. And then I'd say to myself, I'm not listening to my own advice. I'm busy. My children were really little. I'm too busy. I gave myself all the excuses in the world. And that one day I said to myself, whatever advice I give other people, I have to give myself as well. And so I really, really think that. So if there's a day that I think that I'm going to miss my aerobic exercise now, I think, well, this is not the way to protect my brain, and I am very, very aware of that. And diet as well, eating the rainbow, eating lots of vegetables and fruits. If there's a snack that, seems like a good idea, well, then make it an apple. It's hard. I have a huge sweet tooth. I love food. I don't like exercising, but taking those steps when you know the consequences, when you read a paper that says, people with a MIND diet had a delay of their Parkinson's disease by many years. and then you have then you have your food choices in front of you. It really, having that evidence right in front of you can be very helpful to help you make the decisions. So I really do have taken those lessons to heart for sure.
Wow. Well, thank you. Thank you so much for having this conversation with me. And
Oh, my
any
pleasure.
final words that you want to tell our audience?
I think that so many of the messages that you brought out today are so incredibly important about, doing what you can, but then accepting what you can't, modifying yourself as best you can, and and living as best you can with the real challenges of Parkinson's disease. And kudos to everyone who does, because it is challenging, and kudos to all those care partners out there who have made it their life's work to help their partners. So there's nothing I can add to my respect for everybody out there, both living with Parkinson's and living with a loved one with Parkinson's.
Yeah, well, and kudos to you for all of your work. Thank you for being part of our community and for all the work that you do and making it so accessible and so easy for us to digest the information. I just can't thank you enough. And
My
we'll have you
pleasure.
back.
Thank you so much for having me. It was fantastic.
You're welcome. That was amazing. It was fun to listen to our interview again.
It
We
was.
got some, yeah, right. We got some questions in the on Facebook, and it's a really good one from Anne. She said, "How is Parkinson's diagnosed?"
Great question, Anne. So Parkinson's is a clinical diagnosis, which means that you would go to a neurologist who has training in neurologic diseases and what neurologic diseases look like in a person. And you would present your history, and the neurologist would perform a neurologic exam on you, and would take that information and try to diagnose what's going on, and could potentially feel like your symptoms would be consistent with Parkinson's. That is how Parkinson's is diagnosed, continues to be diagnosed. Having said that, there is a tremendous amount of research trying to find what we call a biomarker, which is some measure that you can either find in some part of the body. It may be part of a brain scan, it may be in the blood, it may be in the urine, etc., that says you do or do not have Parkinson's, or may be able to aid in figuring out how much Parkinson's you have. Is your Parkinson's worse than someone else? So there's a lot of movement to try to uncover a good biomarker. And I should add one more point, is that there is a scan out there called a DAT scan, which is not performed routinely to diagnose Parkinson's, but is available if there are cases that are not clear, that a doctor may not be 100% sure whether this person has Parkinson's, and it can aid in the diagnosis in that way. So there are a few things to think about.
Great question, Anne, and it's so important. And it's good to go to a movement disorder specialist or a neurologist, isn't it, Dr. Gilbert?
Yeah, so I would definitely say, if you're having symptoms and you don't know what they are, you can certainly start with a general neurologist. A movement disorder physician is a person who has received particular training in Parkinson's disease and related disorders. And so if you are particularly concerned about Parkinson's, perhaps you have a lot of Parkinson's in your family and that's sort of on your mind, or maybe you have a tremor, because as we discussed a little bit in our conversation, a tremor is one of the hallmarks of Parkinson's, especially a rest tremor, which is a tremor when you're not moving your hands, when they're resting in your lap or by your side, and you see a rest tremor. So that may be a clue that Parkinson's is what's going on. Then you may want to see a movement disorder specialist who has particular expertise in Parkinson's disease. But for a more broader view, a general neurologist may be helpful as well.
And it's important to just note that if you've seen one person with Parkinson's, you've seen one person with Parkinson's, right? The symptoms do vary from person to person. It's kind of sometimes referred to as the snowflake disease, that it's can manifest. Some people, I had one student, it just manifested, it affected her voice, and that was it for a long time. And I bet you have seen those kind of situations too.
Yeah, absolutely. There's a lot of variability. And so you may have been told that you have Parkinson's, and that brings you, let's say, to a a website about Parkinson's, and that could be very, very overwhelming because it lists so many different symptoms that may happen. And it's always good to know that not every symptom that's mentioned in relation to Parkinson's happens to every person. In fact, it's pretty much guaranteed that you don't have every single symptom, that you have a selection of those. And so there's a lot of variability there, and that's very important to keep in mind.
You know, Dr. Gilbert, I wanted to go back to the topic of genetics for a moment. If someone in their family has Parkinson's, should they get tested? Are you definitely recommending that?
Right. So I would say no. It is a very complicated topic, which I emphasized in our conversation. If you do not have symptoms of Parkinson's disease, yet you have a family member with Parkinson's disease, the recommendations in general is not to go ahead and get tested yourself if you are not showing any signs. Depending on what genetics your parent has or your first degree relative has, that will affect the chance that you have inherited that mutation. So let me try to explain that a little more. Everyone who has Parkinson's disease has a certain genetic makeup. Some of those changes, those mutations that a person with Parkinson's may have, will increase their risk more or less. The totality of a person's genes will be what pushes a person to have Parkinson's or not. There are certain mutations that increase the risk a lot. There are certain mutations that increase the risk a little bit. And so the children of those people may have inherited a mutation that increases the risk more or less. And so when you're taking all comers, all people with Parkinson's, the children's risk may or may not be increased by very much. There's a lot of questions between the parent and the child. And so if the parent does not know what their genetic mutation is, to start looking in the child, there's probably not so much information that you can gain. If the parent does know their specific mutation, then you can look for that specific mutation in the child, and there's more sort of use to that test. And as I mentioned in our previous conversation, one of the reasons why you may want to have this information is that now there are clinical trials which are focusing on people with a specific gene mutation. And so that would be a reason to know your status. But still, there are no clinical trials, to my knowledge, that are testing a drug in somebody who has a mutation but no symptoms. It's all being focused on people who have mutations and symptoms. And so again, to burden yourself sort of with the knowledge of a gene mutation when you have no symptoms at all is really not standard of care at this point. It may become standard of care eventually, but right now it is not standard of care. Another thing to mention, which we talked about in our conversation, was this concept that there are clinical trials now that are focusing on neuroprotection, which is not symptom control, but actually preventing the disease. Once we have that molecule, well, then knowing our risk factors when we don't have symptoms is going to become much more important. So this is really an ongoing conversation, and it's not and my answer may change tomorrow based on new thoughts or new research or new ideas. So and there's a lot of emotion behind these conversations. So to be continued, I would say.
Yes, in fact, we have a specific question. Dr. Gilbert, this is your former patient, Emil Miscoli, M-A-S-C-O-L-I. Yes. Yeah, I recently found out that I have a mutated GBA gene. Any thoughts?
That's a wonderful question, but I certainly don't want to be talking about specific medical information about one particular patient. I'm happy to reach out, so I'm going to ask the family to email me at rgilbert@apdaparkinson.org. I'll say that again, rgilbert@apdaparkinson.org, and we can continue the conversation.
Wonderful. I love that we can make that connection and that you can help them get some information, and guidance in that. What kind of support would someone want to put in place if they decide to explore their genetic risk factors for Parkinson's to help them get through what could be a stressful time?
That's a great question. And I would definitely like to emphasize that anybody who is contemplating genetic testing, whether they do or do not have symptoms of Parkinson's disease, to work with a genetic counselor. A genetic counselor will sit with you and will discuss the details of what each result means. And as I said, they're complicated. So one gene that you may discover you have increases the risk a little bit. One gene may increase the risk a lot or more. And a gene that increases the risk more, there's another layer of complexity because, for example, the LRRK2 or LRRK2 gene, which is one of the genes that can be tested for now, and if you carry it, your children, and your children carry it, let's say you pass it on to your children, that increases the risk of Parkinson's to about 30%. So all comers have a risk of Parkinson's about 1%. If you have a first-degree relative with Parkinson's and you know nothing about the genetics, all comers, the risk is about 4%. If you know that you carry a LRRK2 mutation, your risk is 30%. However, the gene also has something called incomplete penetrance, which means you may inherit the gene, but it doesn't do anything to you. So that 30% is not really 30%. And so it is a very, very complex situation, and you need to know all that so you know what to do with the information, and you know how to process the information once you receive it. So working with a genetic counselor to explain the concept of risk factor, to explain the concept of increased risk, and what that means for you is so incredibly important when you're dealing with this type of information.
And I couldn't agree more. And as we get more of these sort of where you can send away, for your gene profile, it really can be quite scary to navigate that and get that information back on your own. It's nice that it makes it accessible to everyone, but when you're dealing with this kind of specific, it's really helpful to do it with somebody who can walk you through it, because you can scare yourself unnecessarily. Wouldn't you agree?
Absolutely. And just to mention a little bit about those direct-to-consumer genetic testing, there's a whole other level of complexity, which is what actually is being tested in each test. So when you get a gene genetic testing through your doctor, you may have this list of genes that are being tested for, or this way that your genes are being analyzed. But when you go with the direct to consumer, that's actually a much smaller list, and it may only pick up particular mutations of particular genes. And so you may not be getting nearly as much information as you think you're getting. And so understanding what information is coming back to you is very important. So I would recommend that if somebody does do that direct to consumer testing, to bring in the results to the neurologist so that that piece of paper can be read with you and you can understand. Because I have had the experience that someone says to me, I have a mutation, and I got the direct to consumer testing, I have the mutation, and I said, oh, that's so interesting. And I put it in their chart. And the next time they come with a piece of paper, and the piece of paper actually said the opposite. They had completely misread the paper. And so getting feedback from the neurologist about what the direct to consumer reporting is and what it means and what information you're actually got.
Wow, that is so helpful. And your degree in cell biology and genetics is really coming in handy, isn't it?
I think every neurologist has to learn about genetics these days. I think every doctor has to learn about genetics these days, because really, as we discussed in our conversation, every chronic disease, the risk of any chronic disease is a combination of your exposures and your genes. And that's for heart disease, for asthma, for cancer, and for neurodegenerative diseases too. So understanding genetics is a huge part of medicine these days. That's just reality.
And one final question. We were talking a little bit about it. I know people out there might be concerned about the Delta variant and, getting Parkinson's and should they be wearing masks, and what is your recommendation right now for people living with Parkinson's?
Great question. So in general, obviously people with Parkinson's have been interacting with COVID-19 the last year and a half, like everyone else. And there used to be, when somebody asked me a question about generally COVID-19 and Parkinson's, I didn't have a lot to say early on, March, April, May. And then over this year, there have been studies, all sorts of studies about people with Parkinson's who developed COVID-19. And is the risk increased? Are there specific things to consider? And so in general, it has been established that for mild to moderate Parkinson's, people who develop COVID-19 have the same sort of profile as people who do not have Parkinson's of the same age. So there doesn't seem to be this huge increase in morbidity from COVID-19 in people with mild to moderate Parkinson's. As Parkinson's advances in moderate to advanced stages, then absolutely Parkinson's seems to definitely increase the risk of a complicated course of the disease. It doesn't seem to increase your getting it, but it seems to increase the complications. And that seems intuitively obvious. If you have a weak swallow, a weak cough, you can't clear your secretions, your respiratory status is going to be compromised somewhat, and you're going to have problems with respiratory illnesses. And we definitely see that. And there have been many casualties of that combination of COVID-19 and advanced Parkinson's. And then the vaccines came, and our community as a whole, or in general, obviously not everyone, and I do not mean to overly generalize, but people with Parkinson's, especially advanced Parkinson's and moderate to advanced, were very eager to get the vaccine, and the community has had very high vaccination rates. So now you're asking about the Delta variant and what that means. So I am not aware of any particular study that has looked at the Delta variant and Parkinson's disease yet, but I do expect that somebody will, because that's the nature of scientists. They have a question that has come up and they're going to try to answer it. And so stay tuned. There may be some more information. My gut tells me that it will be the same answer as the other variants. So whatever information we glean about the Delta variant and people who have chronic diseases are going to be the same case for Parkinson's disease, and it won't be unique information for people with Parkinson's, and probably will be the same as the other variants of COVID-19, I think, but of course we don't know. The big question out there is, how much do the vaccines protect people against the Delta variant? And certainly the official word is that the Delta variant seems to get good protection from the vaccines. And even if a person who is vaccinated does get the Delta variant, their course is less complicated than it would have been. And so vaccines seem to really hold us for the Delta variant too. However, anecdotally, there do seem to be cases that are accumulating of people who have been vaccinated who have gotten the Delta variant. So I think this is again, a work in progress, and our understanding of this variant and maybe other variants are evolving as we speak. But for now, vaccinations definitely seem to protect against the Delta variant for the most part. And if you do get the Delta variant and have been vaccinated, then your course is much more likely to be less complicated.
Wonderful. Thank you for talking about that, because it's just really prevalent right now, and it's really up on everybody's mind. And we have a few folks that have joined us and have some questions. So can I take 5 more minutes of your time, if that's all right?
Absolutely.
Okay. What is your input on CBD? Does it help with symptoms?
Great question. So there obviously is a movement to use medical marijuana for all sorts of things. And there is a good medical evidence that it helps for particular situations like pain, nausea from chemotherapy, for example, and those are great uses for medical marijuana. Does medical marijuana help for any of the symptoms of Parkinson's? This is a work in progress. Again, there's a lot of research going on. The research, of course, is stymied because federal money can't be used right now for medical marijuana and chronic diseases research, which is a shame. And there is a lot of movement to try to correct that so that we can study these questions and figure out what parts of Parkinson's medical marijuana helps for. So there is, if one had to imagine what medical marijuana might help for a person in Parkinson's, one could imagine it might help insomnia, it might help pain, it might help nausea, etc. And so, it isn't a crazy idea to be working with your neurologist, asking about medical marijuana for those particular symptoms of Parkinson's. Having said that, medical marijuana also has side effects like any medication, and so one has to be aware of what it might do. It might cause drowsiness, it might cause clumsiness, and so one has to weigh the potential benefits and the potential risks. And I certainly wouldn't poo-poo the idea completely. I definitely investigate the particular symptom you're trying to treat, work with your neurologist about potentially trying it if it's something that the side effect profile makes sense for you.
Yes, and I remember interviewing Matthew Fink, who's a chief neurologist over at Weill Cornell, and he was saying if you haven't taken marijuana, like some people, used it when they were younger, right? If you're a first-time user, what he's found in his patients, it can disturb their balance.
Mm-hmm.
He said you have to be really practical about this.
Mm-hmm.
You don't want anything to interrupt your sense of balance if you are not stable. So
100%.
our whole conversation today has reminded me about how much common sense is really important, right? And what I mean by that, and I don't mean it in a it's a reminder to myself, right? To get your sleep, eat right, the Mind diet or the Mediterranean diet, get your exercise in there, ask your doctor, wear your mask if you're at, a crowded place, right? And wanting to go out to decrease your risk. And yet it's so helpful to be reminded of this in such an accessible and beautiful way. Thank you so much for sharing your lunchtime with me and for all the wonderful information you shared with us today. Do you have any last minute thoughts you want to share with us? And I know you're going to be working with our staff next Monday. I'm very excited about that.
I am. I just want to say thank you everyone for tuning in and listening, and keep your questions coming, because being educated about your condition, that's the way to find out ways to help yourself. So thanks for all your questions.
Yeah, and if you'd like to sign up for our Living with Parkinson's programs at the Marlene Meyerson JCC Manhattan, please see the link in the comments to fill out an intake form. The form is very short. It's not complicated at all. And the Edmund J. Saffer Wellness Programs at the Marlene Meyerson JC Manhattan, we've been doing this for years. We love to help folks and prevent isolation and keep you moving and keep you healthy. So please, please join us. For now, be safe, be well, and we'll see you next week. Next week, by the way, is Gloria Lebeau. She's a licensed clinical social worker and the director of social services at the Friedberg JCC, and we're going to discuss the role of social work and what it plays in managing Parkinson's. So take care, everyone. We'll see you next week, and thanks so much to Dr. Gilbert. Bye now.
Thanks for having me. Bye-bye.